I introduce Robert Giovanni Nisticò, who is the president of AIFA. He is a medical doctor specialized in psychiatry, and he is a full professor of pharmacology at the Rome University Tor Vergata. He has an impressive curriculum about research in neurological science, and he is also president of the course of the degree in pharmacy at Rome University of Tor Vergata. Welcome, Robert. Please go ahead.
Sorry for bothering you, but I have to leave very soon because I have another meeting in Padua. So unfortunately, I cannot be there with you today. And next time I will join physically the meeting. So I'm online today. So this is unfortunate for me. This period is quite busy, I have to say. I just entered the agency 6 months ago. Now we are undergoing a reform. So, I mean, this is what you already know about the agency, the Italian Medicines Agency. We regulate, of course, medicines for human use in Italy, and we also govern pharmaceutical expenditure, as you know. So this is one of the characteristics, I have to say, of AIFA, also in comparison with other non-competent authorities. We operate independently, transparently, efficiently under the guidance of the two ministers, the Ministry of Health and the Ministry of Economy and Finance, and also we are in conjunction with regions. So we are building up also a stronger relations with regions, the Istituto Superiore di Sanità, the IRCS, hospitals, healthcare systems, patient associations, and so on. So we have a lot of activities running in our agency. Of course, the main aim is to guarantee access to medicines for the safe and appropriate use as a health protection instrument. We also ensure the national unity of the pharmaceutical system in agreement with the regions. We provide, as I just was mentioning, the governance of the pharmaceutical expenditure in a context, as you know, of economic and financial compatibility, and also of competitiveness of the pharmaceutical industry. We ensure innovation, efficiency, and simplification of procedures, and this is one of the new, let's say, aspects of the reform. So with the new reform, we are trying to build up, let's say, an agency which is less bureaucratic, which is fast in the evaluations, and also the new Scientific Economic Committee also has the aim to provide faster, let's say, access to medicines, of innovation. And of course, we are a non-competent authorities within a network of other non-competent authorities. So we are part of the HMA, and of course, also we relate to the European Medicines Agency, as you all know. Now, one of the issues is, as you can see from the next slide, the fact that we actually are a regulatory agency, and within our agency we have an HTA body. So this is something quite peculiar in the European landscape. Of course, we have a problem of resources, I have to admit with you. But still, I mean, we are involved in the pricing and reimbursement, in the definition of these management entry agreements, which you all know are conditional access agreements to the market for innovative or high-cost drugs. Notes and therapeutic plans is also within the remit of the agency, monitoring registries, and also innovativeness, which we also now actually refining in the new legge di bilancio. Of course, we are undergoing a reform, I was telling you. So this is now, we are in those days, actually yesterday we have the management board in which we discussed the way we want also our agency to be organized. So we are actually nowadays in the process of approving the new organigram, you know, of the agency. And now the agency, from the peculiarity is that we have a new head, which is the president, which is the legal representative of the agency. Before it was the general director. We now have two directors, which is the technical scientific director and the administrative director. And one of the main news of the agency is that nowadays we overcome the two commissions, the GTS, which was evaluating the technical scientific aspects, and the GPR, which was instead, let's say, important for the economic aspects. And nowadays we have the GSA. And I have to say that although before these two commissions were, let's say, two commissions which were very efficient, but still the fact that there were two commissions made, procedures to bounce, let's say, from one commission to another. And this actually, costed a lot of time. So even though 16 colleagues were part of the two commissions, and now we have 10 persons that are part of this unique commission, I can say that we are speeding up a lot the work. So it is mainly within the organization of these two, of this only, let's say, committee, as you can see here from the Scientific Economic Committee. And of course, the Scientific and Economic Committee is able to, I would say, roughly to, let's say, speed up a lot the decisions, which then are, let's say, approved by the management board, and they are finalized into the determina, which is an administrative act, which is then published in the official gazette. And as you know, Italy, let's say, from when we received the dossier to when we actually authorized drugs on the market, we take an average, at least in the past, we took an average of 424 days, which is, I would say, within more or less the average in the EU. However, we have the regions also, which also contribute to this time. So we are really somehow have difficulties in taking innovation and bringing innovation to the patients. So after this reform, I can say, I don't have the numbers, but I can tell you that, for example, we managed to in premise to take, to finalize all the pending procedures. So we had a lot of pending procedures from the past two committees. So in actually a few months, we were able to finalize all these pending procedures. And nowadays we are speeding up. And I can say that I cannot tell you exactly, but we are almost half of the time. At least this is our aim, is to try to half the time from these 424 days in order to speed, access to innovative therapies for our patients. Of course, HTA, you all know what is HTA. I'm not here to tell you what is the HTA, but we are on the one hand aiming to protect, to promote public health by licensing safe and effective medicines, and on the other hand, we are actually involved in the governance of public pharmaceutical expenditure. That's why we are under the control of both ministers, health on the one hand, and MEF, economy and finance, on the other hand. Nowadays, of course, there's a lot of attention on these early access schemes. So we have driving forces that would aim to reduce time to market authorization. This is the industry, which of course requires a favorable condition for innovation. On the other hand, patient groups, especially when you don't have any alternative therapeutic, let's say, intervention. So we need to be really fast. Otherwise, some diseases, which are progressive diseases, degenerative diseases, if you are very slow, you will not be able to, to target them anymore. On the other hand, you have payers, HTA organization, but also the media and scientific community, which demand, a longer time to market authorization. So we need really to balance these two aspects, these different driving forces. And in general, in Europe, the unmet need and a presumed favorable risk-benefit profile are common as selection criteria for all the early access schemes programs in the EU. So Italy has also some schemes. I have to say that we need a bit to let's say, modernize these schemes. These are the legge 648 and the Fondo 5%, for example. On the other hand, Germany, France, Spain, and England are also countries with early access schemes, which are even interesting, actually, to follow. And it is also important to see, actually, here this slide, because we always try, to understand if we treat early the patient, is this a cost or is this an investment? So you need now to think in a wider way, not in a silos-like type way. You need to think in a broader way, because if you treat patients early, you can see you can actually, save a lot of money. So these are, let's say, just to give you an example, 5 examples in which you have the cost increase in euros and avoidable cases. So this is the total cost which would be attributable to progression of cancer occurring during the negotiation process in Italy. So the negotiation takes, I told you, roughly 424 days, but even more sometimes. And this is a cost because patients are hospitalized, patients indeed cost. So the idea would be actually to save money in treating the patients early, although there's a lot of uncertainty even if you treat patients early. So here, of course, this is the role of HTA. The HTA, you know better than me, you have an important role in the pre-market setting, in the market, in the post-marketing as well. So as you can see here, you have different type of analysis which are in place. And I move forward. This HTA regulation, of course, started in Europe in 2021. Now we are in 2024, towards the end of 2024, and I have to say that we are getting ready, we are getting prepared for the January 2025, in which we will have the kickoff of the joint clinical assessments. And of course, in 2025, these medicinal products falling under the regulation, of course, needs to be subject to the joint clinical assessment. And this joint clinical assessment will concern medicinal products with new active substance for which the therapeutic indication is the treatment of cancer, as well as advanced therapy medicinal products. In 2028, actually from 2028, also orphan medicinal products will be considered. And from January 2030, the idea is to have all the medicinal products falling under the scope of this regulation. So this is the new, of course, EU regulation, and this is actually the idea also behind it is to avoid that the manufacturers must carry out data, information, analysis, which are often different for each European country. This is also to avoid duplicate effort and to avoid limits to market access in different countries. And the regulation expects a mechanism that guarantees the data, information, and analysis necessary for the joint clinical assessment. And when you speak about also the EU regulatory agency's role, of course, accessibility is our, let's say, our aim. I mean, one of the issues which is part of the European Medicines Agency network and also the European Medicines Agency network strategy, which was recently discussed up to 2028, is of course accessibility. So accessibility needs to be rapid, accessibility needs to be equal. For example, in Italy, we have one of the problems is the disparities in accessibility among the different regions. We have 20 different regions with different timings and different also procedures. So harmonization even within the national, let's say, territory is of utmost importance. And of course, this accessibility is one of the first issues that EMANS, the European Medicines Agency Network Strategy, defines. So this is actually has been recently discussed at the European Medicines Agency level and also in the Head of Medicines Agency. And accessibility also is, as you can see here, accompanied by the issue of data, how can you exploit data, digitalization, artificial intelligence, innovation and competitiveness. Antimicrobial resistance is another issue. The environmental impact of drugs is also important to understand, to study availability and supply, and also sustainability of the network. We are discussing a lot about the sustainability of the network and the capacity of the network, because we are facing difficulties not only at the national level, but I have to say also at the European Medicines Agency level. So of course you know all that probably much better than me. So you have clinical assessment domains, which these are more suited for a joint assessment at the EU level on the scientific evidence base, and for which the HTA regulation provides a framework for, even though societal aspects may influence the status of the current technology used, which may differ between member states. And according to HTA regulation, the assessment of non-clinical domains will still be related to national and regional contexts and approaches. So we need to implement joint clinical assessment at the national level. So there have been several meetings taking place. Also today in Rome, there was the HAG meeting, and I actually went this morning. Also, the Minister of Health was there, Razio Schillaci. So there is actually a lot of interest and a lot of political interest in how to implement this at the national level. And from our point of view, of course, we believe that this harmonization is useful to ensure faster access to new health technologies for Italian patients and avoid redundant efforts in evaluating trials, allowing AIFA to focus on the nation, on the country-specific health needs, such as decisions on pricing and reimbursement. AIFA is currently preparing to implement the joint clinical assessment process, but we have a problem now of also capacity of resources. In AIFA, we are roughly 670 employees, but also we have the HTA area inside, and you know, this for a medium big country as Italy, you know, compared to other agencies in Europe, we are running a bit low of employees. The agency, of course, is adjusting and matching its national procedures and documents to those that have been prepared for the HTA regulation. These are some challenges that we have been identifying in relation to implementing this new regulation in Italy. So which is the role of relevant institution? How can we use data? Which is the interoperability of system, the role of patients' organization, the stakeholder involvement, the PICO scheme, as you know, which are used and defined at national level. And the PICO scheme is to be addressed in the joint clinical assessment. Now we have a lot of challenges related to this. For example, the generation of an extensive amount of data within a short time frame. And also another challenge is the potential lack of overlap between the pivotal clinical trials and the national PICO scheme in terms of comparators, for example. So this challenges direct comparison. And considering the very short time frame of the joint clinical assessment process, which is running parallel to the approval processes, an alignment of the PICO scheme requirements should be considered, in my personal view, as early as possible to ensure a complete and beneficial joint clinical assessment. Another point is the real-world evidence, which you all know. I mean, traditional HTA approaches rely primarily on randomized clinical trials to generate clinical evidence. However, there's an increasing recognition of the importance of integrating real-world evidence, which are derived from real-world data sources, into the HTA processes. And real-world evidence, we know that it can provide a more comprehensive understanding of interventions, effectiveness, and safety in clinical settings. So this addresses some of the evidence gaps which are faced by companies and also HTA organizations. This also is important because, you know, at the level of the European Medicines Agency, there's been the Darwin, EU project, and this aims to provide access to valid and trustworthy real-world evidence from across Europe on diseases, populations, and the use also and performance of medicines. So this an increasingly recognition of the role of real-world evidence, which may support regulatory decision-making, which is often followed by HTA to support reimbursement decisions. Of course, there are country-specific factors. We highlight the need for ensuring that country-specific factors such as epidemiological trends, healthcare system structures are adequately addressed during the national adoption phase on the one hand, and we also view the ability to adapt HTA outcomes to the Italian healthcare context as crucial to ensuring that decisions reflect the needs of the Italian National Health Service, which started from the 70s, as you all know. So the strategy is, of course, is a proactive involvement and the possibility to streamline national decision-making. We are actively preparing the agency for the upcoming changes, and of course we are working on the increasing capacity. Now we hope that we can expand the personnel in the next few years, although this is a difficult task in Italy in these days. I mean, we have the legge finanziaria and the legge di bilancio, which we hope can support also the agency. In any case, we need to intensify collaboration, international collaboration with key stakeholders and also with other non-competent authorities and with other HTA agencies across Europe, sharing knowledge and best practices to improve the overall efficiency and effectiveness of HTA processes. So I thank you for this meeting.
So thanks very much for this excellent introduction and perspective and outlook of AIFA's role and process and strategy. Do you have a couple of minutes for additional questions from the room? Do you have a couple of more minutes for 2 or 3 questions?
Well, I actually have a train. I have a train in 20 minutes from Termini. I need to go from AIFA to Termini, which makes it quite challenging with the traffic we have those days and all the work that we have on the roads.
So let me shoot one question, and if there is one in the room.
Yeah, please.
We have heard, let's say, that there's currently the discussion who is taking on the JCA assessments by next year. So there's rumor that IQWiC suggested 8 of the 25 and so on. So will AIFA be involved in the assessments and also in the JCAs from next year on?
There are we have 2 options, so we have to go for the option B. In other words, we will be involved, but not as protagonists in this phase, because we need to build our capacity. We have a very small HTA area nowadays, but we are undergoing this reform, this reorganization. So actually what we need to do, we need to invest on competence, because in Italy we have a lot of competence. I have to say we have a lot of experts, and we need also to build on the gruppi di lavoro. So we need also to have teams that work, that surround AIFA with their competence. Nowadays, one of the problems, as you know, is the conflict of interest, which is a very sensitive topic. And actually yesterday in the management board we also approved a new conflict of interest regulation, which leaves us a bit more space towards bringing in some competence. So these are issues that we are facing nowadays altogether, but I hope that within the next few years we can really be more actively involved in these assessments.
Thank you very much. Again, a big applause. Thanks, Bye.
So thank you.